evening, everyone. Our speaker for today is Dr. Eileen de Villa. She is the Medical Officer of Health for the City of Toronto. Dr. de Villa leads Toronto Public Health, Canada's largest local public health agency, which provides public health programs and services to 2.9 million residents. Prior to joining Toronto Public Health, Dr. de Villa served as the Medical Officer of Health for the region of Peel. Dr. de Villa received her degrees as Doctor of Medicine and Master of Health Science in Health Promotion from the University of Toronto and holds a Master of Business Administration from the Solich School of Business. Dr. de Villa is also an adjunct professor at the Dalla Lana School of Health at the University of Toronto. I'd like to give the floor to our esteemed speaker for tonight, Dr. Eileen de Villa.
Thank you. Thank you very much, Edna May, for that very kind introduction. Nice to see you. Unfortunately, forward to when we can gather again together in person at some point, I hope, in the not too distant future. So good evening, everyone, and thank you for inviting me to speak with you tonight. It's always my pleasure to be invited to speak to my fellow Filipino Canadians here, and always an honor to have the opportunity to interact with each and every one of you. You've heard a little bit about who I am and what it is that I do, and it's been keeping us very, very busy at Toronto Public Health for the past several months now. And, it comes as no surprise, I'm sure, to all of you that when I was asked to speak with you today, I was asked to share an update on the COVID-19 pandemic, which has affected every single one of us here in the city of Toronto and beyond, and to give you an update on what our current situation is here in the city. I'm sure that you have many questions. There have certainly been recent increases in COVID-19 cases. So understandably, when I come out to speak to different groups around the city, one of the key questions is what you can do to keep yourselves and your families safer. So I'm very pleased to be here, to have this opportunity to speak with you, to share an update, and of course to answer your questions, which I always find is the most interesting part of any given talk. So I last addressed this group back in February, and that almost seems like a lifetime ago. I realize it was only, about 6 months ago or so, but it does seem like a very, very long time ago. However, I think it's still important that while several months have passed, and while we have learned quite a bit about COVID-19 and SARS-CoV-2, the virus that causes it, this is still very much an unprecedented global pandemic caused by this new virus, which was completely unknown to us just 10 months ago, right? Completely unknown to us. So with that in mind, the science about this virus is still unfolding, and we are still learning because it is still a relatively new virus as far as we're concerned. And what that means is that in the realm of public health, we're still having to adjust our actions and recommendations based on new facts and new understandings of the virus as they're confirmed. And as well, we have to adjust our actions based on what best fits our local circumstances. So I don't need to tell you that for the past several weeks, we've seen a steady and very concerning increase in the number of people who've been contracting COVID-19 in our city. I can tell you that right now, more than 21,000 people in the city, almost 22,000 in fact, have contracted COVID-19. And when I look at our data, even in just the last 8 days alone, we have had 2,000, almost 2,000 cases just in the last 8 days. That's almost 10% of all the cases that we've had so far here in Toronto since the beginning of the pandemic. So there is no question that there is an immediate rising risk here in our city of continued and significant COVID-19 resurgence. We know that COVID-19 is spreading in our city in a serious way, and it will come down to the choices that we make together, the choices we make as governments, and the choices that each and every one of us makes as individuals. What choices we make determine whether the spread of the virus is going to get worse or whether it's going to get better. And that's why you will have heard me say over the last several days and weeks now, I'm really asking everyone to restrict contact as much as possible to the people with whom you live, people in your household, the ones you live with regularly, day after day, or to those people who help you at home on a daily or regular basis. I recognize that there are some people who are in circumstances where people do come into their home to help them with important self-care and healthcare needs. Those people should continue to provide that care. But otherwise, as much as possible, you should be limiting your contact exclusively to those people with whom you live at home with whom you share a roof. And I know, I am completely understanding of the fact that this advice that I offer is very, very hard to hear. You know, I can assure you it is very, very hard for me to give, especially given that here we are on Thanksgiving weekend. Nobody wants to really stay away from, our extended family and friends during holidays. This is not what anyone wants to do. And in fact, especially with Filipino culture, this is completely opposite to everything that, we hold near and dear to us, especially during holidays. But I can't emphasize enough how much we need to make really hard choices right now in order to preserve the safest environment possible for all of us on a go-forward basis. Very, very simply, to my mind, I don't want to see any more people in our community to get a COVID-19 diagnosis or to have to experience the anxiety or worry of waiting for the results of a COVID-19 test. And that's why I've been asking people, and I will ask you again today as we approach the Thanksgiving celebrations within just a day or two, depending on when you wish to celebrate. Please don't hold a big Thanksgiving dinner. Limit your Thanksgiving celebration. Give thanks, yes, but give thanks only with those people that you live with. And for those of you who live alone, the safest option to celebrate Thanksgiving with others is to actually join family or friends virtually, just like we're doing here tonight. I've been telling people I would far rather that we change our plans for this one Thanksgiving for safety's sake, rather than finding ourselves in a place where we're looking back at Thanksgiving 2020 with regret and wishing that we had done something different. At the end of the day, the most powerful weapon that we have against COVID-19, our greatest strength in dealing with COVID-19, is you. Every single person here in the city of Toronto. And, very, very simply, we need to come together as a community, just like we did last spring. I ask everybody that, whatever it is that you do, that you might actually get into contact with other people, I would ask yourself first before you do that, do I have to do this action? Do I have to do this activity? This is, an important thing that we're asking every single person to really think about. When you're about to go and do an activity, ask yourself, is this something that I really need to do? Or is this something that I just want to do? And if it is something that you want to do, when you realize that it just might be not really an essential thing, but something that you just want to do, I would ask, can you put it off until a later time? Does it have to be done now? And even when you're thinking about those things that you need to do, I would ask you to think about what is the safest option for doing that. Are there virtual or remote ways to get that activity that you need to do done? And if there aren't virtual or remote ways, are there ways in which you can either do that activity outside or make sure that you're keeping at least 6 feet distance and wearing your mask as much as possible and washing your hands as much as possible? And of course, if for some reason you have symptoms of illness, I would ask that you isolate, not come into contact with others, unless it's to go and seek health care. And in which case I would ask that if you're seeking health care for your symptoms, that you wear that mask, you maintain distance, and you let your caregivers or the healthcare providers know about your symptoms as early as possible. Every single one of your efforts makes a difference. Every single one of your efforts makes a difference in our community, in protecting health, and yes, in saving lives. Every single action you take brings us one step closer to getting more of our lives back. So I will wrap up my remarks. I'm very happy to take any questions, but before I close, I just want to thank each and every one of you for doing your part to help reduce the spread of COVID-19 by following public health advice, by staying informed, and by participating in virtual events like this one in order to keep yourself informed. I can't thank you enough for your attention. And with that, I'd be very happy to answer any questions that you are. A small number of people for whom flu shot is not recommended. And this is something, again, depending on your own individual circumstances, that you should discuss with your own physician. But by and large, I recommend the flu shot for everybody because it is one of the most effective ways by which to prevent influenza. And I would tell you further that this year, given COVID-19, it's more important than ever that we protect as much of our population against influenza, which itself is also a cause of serious illness and in many cases can also lead to serious complications and death. So all the more reason, knowing that we've got COVID-19 circulating in our community, extremely, extremely important for people to get the flu shot. Save and exclude for that very small proportion of the population who should not be getting flu shots because of pre-existing medical conditions. And there are very, very few of those. So flu shots are increasingly available in the community now through healthcare providers and soon will be available through Toronto Public Health Clinics. I would encourage you to get in touch with your healthcare provider, find out when they're getting their allocation of flu shot, and or look at pharmacies who are also active participants in the flu vaccine campaign. Those should be more and more available in the coming weeks and will be an important part of making sure that our community is as protected as possible from influenza virus over and above all the things that we're trying to do to prevent COVID-19. I think if there is one good piece of news here, or a piece of good news, I guess I should say, it's that all those protective measures that we're advising people to take on and to adopt in order to prevent COVID-19, they also happen to be really good at preventing influenza. So following the self-protection measures, using the flu shot, this combination is very, very powerful in terms of protecting your own health and the health of others around you at this time.
Thank you. And we received a comment from Lazaro. Thank you, Dr. Eileen, for the great job. For the remaining questions, we have from Ola. When will the flu shots be available in Toronto?